it's Debbie, dentalpracticesolutions.com, and Susan Ketterer, our expert consultant.
Well.
And we're here with the office manager at the office of Labiner Oral Surgery in the Bronx, New York. And this is Minerva. And we wanted to ask you a few questions. Minerva, can you explain to us, what was it like working here? You've been here for at least 25 years?
Yes.
And what was it like before Susan and I came to work with you this week?
I guess everyone wasn't clear of the job definitions and descriptions, and by being here you have really enforced them as to look into themselves as to what their responsibilities are, and go follow every detailed job description that they have.
Great.
Very minimum, everything between daily, some weekly, monthly, and they're very appreciative. They're very much aware. Thank you, ladies.
Oh, you're welcome. I think having them work through that exercise and have them actually write down all the different little tasks they complete during the day, week, and month is something that they can refer back to, and also you can be able to refer back to make sure that you have a tool now to reinforce what we do. And it's basically a list that they have that is just a physical presence versus not really knowing 100%, what things are.
Yep, thinking about it. Yep.
Do you think that there will be a lot more accountability now? It seems like we've really identified some more strategic plans, and we've dived deep into what are the different exact specific tasks of each member of your team. But do you think that these people, your team members, are going to be held accountable? Is there a plan in place for that?
Yes, it is. We're going to look into it on a weekly, daily basis. I am going to enforce it with them. We're going to go over it. They're asking me. They're very much aware of everything. So I'm happy. I'm very much happy. Yes,
and then with the monthly meetings and the annual meetings that we are talking about, that you'll be able to get together with them and be able to discuss different things with the office.
Yes.
As well as the reviews that you were
Yes,
planning.
Can you explain that so that people understand that prior to coming here, can you explain about the employee reviews and the team meetings that you had monthly? Can you explain, was there existence of that and what we have now?
No, they were very limited. Because of the rush, I guess we just kept procrastinating and leaving it for another week, another month, and before you know it, months went by and we wouldn't have it. And we're going to really enforce it now. Yes.
So now we kind of got we got our 2014 calendar, and we're marking in those dates.
And just putting it in there and stop whatever we're doing just to take the time to do it. Yes.
And then before, did you have the reviews with your team members scheduled on the calendar? Was it
not scheduled? Like I said, we would do it periodically, maybe once or twice in the year, maybe.
Okay.
If it came to that, because after time you saw it, just went by and we wouldn't do it.
So now that we have the employee reviews scheduled, these are not salary reviews. These are employee reviews that we've scheduled. Do you see that this will help keep your team more accountable?
I believe so, yes.
Okay.
I believe so.
Susan, anything you wanted to ask Minerva?
I guess the only other thing with regards to the front office team is that we totally went into detail with specific things on how to answer the phone, how to speak to the patients, how to have patient care, versus what was happening prior to. Like, can you explain to us, like, specifically what Debbie and I helped with your team?
I giving them a lot of scripts and as to what to say, how to say it when the patients call.
Yeah.
Be aware of how they need to take their time to find out patients' needs and not be quick about it. And yes, they are. They're very much aware. They look at me and they go, you see me shaking? I say yes.
Yes.
And as they go, it'll be more comfortable for them as long as they have everything in front of them and they're able to take control of it.
Great.
A lot of good tools.
Yeah, it's been really nice working with you. I know you and I worked very closely, and I took up a lot of your time this week, but I think we'll pay off.
It was worth, yes.
Yes.
It was worthwhile.
Well, thank you so much for everything.
Thank you.
Thank you.